Hello, this is Justine Calderwood with the Healing Spot Physical Therapy. I am a physical therapist, and you're likely watching this video because you're either a new patient of mine or you've reached out for some help, possibly on my website or through my email newsletter. So welcome. Behind you here, you see my clinic, and I'm going to talk to you just briefly about how to use a small inflatable ball such as this. So if you're a new patient of mine, you would have received one of these during your first visit. It's just like a 4-inch inflatable ball, and it's got a little bit of give to it, and I likely taught you how to use it specifically for your body's needs, but this is a great review. Or if you are not familiar with how to use a ball to release tight, painful, sore areas of your body or to increase mobility, then you're in for a treat. I prefer to use an inflatable ball because it's got more give, and a lot of times when people come in to see me, I see people with chronic pain that have been dealing with pain and dysfunction and tension for quite a while, and they're kind of used to pushing through it. Oftentimes I hear people have a high pain tolerance, that they can deal with a lot of pain, and what I have found in the years of being a physical therapist and working specifically with chronic pain and trauma and long-term issues is that that high pain tolerance typically is that the person has actually kind of become a little bit numb to what's going on in their body, because that's how you can survive. That's how you can continue to be productive and not let your pain and dysfunction get you down too far, okay? But the problem with that is that it's not that your pain is necessarily lessened, it's just that you're kind of ignoring it to a certain degree, and you've become possibly even dissociated from that, from the feelings in your body. So I like to use the inflatable ball because it's very gentle. It allows your body to release and gain mobility and actually get kind of that tender, loving care that it actually needs to get out of the dysfunctional patterns, okay? So I might have given you a handout that says small ball, and there may be some pictures in that handout. Again, depending on how you're coming to this video, you may not have this handout, okay? And that's fine. You can always reach out to me and ask a little bit more about that. But what I'm gonna do today is just show you a few ways that this ball can be used, okay? So that you have a better idea of how a simple ball can be used to help you feel better. Now keep in mind, I like to start with the inflatable ball, and I oftentimes like to start on a bed because I find, again, your body needs that tender, loving care. It needs you to be a little more aware of what's going on inside. And so if we go in there and we go too strongly or too quickly or with too much force, and we're trying to really force the body to release instead of allowing our body to kind of drape over the ball, feel really supported by a bed and some like a comfortable position, then your body kind of puts on the brakes if it's feel like you're being forced, okay? So this is why I like to start out nice and supported and with this ball. So this inflatable ball can be used in different positions. So one way I like to start, now again, it depends on what your dysfunction is, what you're really struggling with. I can say probably the number one thing that people come in to see me for are lower back issues, okay? Low back pain, I'll get people that come in with this mid-back discomfort, pain, but then I would say the number 2 issue as far as pain is related is neck pain and headaches, okay? I also see a lot of pregnant and postpartum moms, and they're dealing with possibly different variation of that, okay? So one way that you can use the ball is actually lying down on your back. So let's say you want to release those tight muscles into your glute areas, your buttocks, your lower back. A great way to do that would be to lie down face up on your bed, okay? So you're gonna lie down, and let's say your left side's bothering you. You can put the ball just along that fleshy part, just to the side of your spine, and then you can just kind of nestle it in there, and you can have a pillow up underneath your knees, one underneath your head, and what you're gonna do is just allow your body to kind of drape over the ball and allow the ball to sink into that area, okay? So when we do myofascial release, that's what I do with my patients. We want to allow the body to drape over, okay, and not feel forced. It takes 90 seconds to 2 minutes for the body to start to release over top of the ball, okay? So that's just the start of it. We want to hold and wait for a minimum of 3 minutes, but ideally if you can hold 5 minutes or longer. And the reason for that is That 3-minute mark, you're allowing some release to happen. At 5-minute mark, they've actually found through studies of living fascia that the body starts to release interleukin 8. It's your own natural anti-inflammatory, anti-cancerous agent. Okay, this is what the body is able to produce in order to start healing from the inside out. Your body knows what to do with it. It recognizes that as natural and normal. And so we want to get to that 5-minute mark to allow your body to start to take care of itself. Okay? So this can be used in other areas. It can be put, say, if you're male, along nipple line, female, breast or bra line. So you're just moving the ball up a little bit. You can put it directly on the spine if you're not really sensitive, but you can also put it just to the left or the right. A lot of people have tension into their shoulder blades, so this is a really good way to get into the shoulder blades and even up into the neck area, okay? Nothing says that you can't put this here at your upper back and lie down on it, or even at the base of your head, and you can remove the pillow then, and you can lie down there. So those are some really great ways to release the backside. One thing I like to point out is a lot of people are having pain in the back of their spine, in the neck, mid-back, lower back, because of tightness in the front side. So I also teach people how to use the ball along the front side. So keep in mind, if you're experiencing neck pain, for instance, or headaches, it could be because your shoulders are forward, you're kind of rounded out. Maybe you work at a computer a lot. Maybe you do a lot of writing. You know, most of us work in front of us, right? Kind of this level. And so using that mouse, typing, sitting with poor posture, that starts to pull and tighten down through the pec muscles into the front of the neck, and it starts to pull the body forward. Well, if you can imagine, as our body is being pulled forward, well, we still have to be able to walk and stand upright and look people in the face and things like that. Well, our body, what it will do, instead of being forward like this and looking down, it will actually extend up through the neck, and you'll start to get a lot of tension up into the back side, and then that can lead to that pain, dysfunction, tension, okay? So if we start to release into the front side of the body by using the ball, that can really make a difference, okay? Same goes with the back. A lot of people are tight into these hip flexors, again, from sitting, doing that computer work, sitting for traveling, driving, long commutes, that kind of thing. And over time, the hip flexors start to get tight. And what happens there is, you can imagine, as I start to tighten here, it starts to extend my back, okay, which then compresses the vertebra in my back and starts to pinch down those nerves. So if I start to release into the hip flexors, okay, that can start to release some of my my lower back pain. Okay, so a great way to use the ball for that would be to actually lie down on your stomach. I like to put a pillow up underneath my chest and one at my lower legs, okay? So just around your shins. So that's a great starting position, because then you are nice and supported, okay? But your head is going to be free. So I'm going to show you this. So to release into the hip flexors, you can put the ball just below your rib cage and or all the way down to the front of your hip. You're going to be just to the side of the belly button, okay? So I'm going to put the ball there. I'm going to lie on top of it. And then what I'm going to do is just kind of hug this pillow here underneath me, and then I can put my head face down, okay? Again, I want to hold that position for 3 to 5 minutes, and I can do that on the left and the right side, okay? Another great way to get into the pec muscles and into the chest, I'm going to actually remove the pillow, come to the side edge of your bed, and what you can do is put the ball into the front of your shoulder, okay? Not directly over the shoulder bone, that humerus. You want to be in the fleshy part, into the pec muscles. And then what you can do again, arm over the side, and you're lying on top of it, and you can put your face down, okay? So again, hold for 3 to 5 minutes, and you can start to get a good release in there. The ball can be used in different positions. You can do it sitting. So if you're sitting up against a nice chair, you can actually put the ball into your lower back, and you can lean up against it. I oftentimes recommend to people, put this in your car. If you are somebody that travels for work, if you know you have that long commute, and if sitting for long periods of time, and especially driving, seem to aggravate the sensations you have, use the ball, put it in your center console. Put it along the middle of your back and kind of lean up against it. You might have to recline your driver's seat a little bit so that you're not pushing too far forward. Of course, you always want to be safe. You don't want to use the ball if it's going to distract you from being able to pay attention and react to traffic and your driving experience, okay? This ball can also be used up against a wall. So you can imagine, you know, if you're feeling that into the buttocks, you can lean up against a wall, put that into your upper buttock area or lower, wherever you're feeling that, and lean up against the wall. That gave you some great ideas, some ways to use the ball in different positions. So keep in mind that this is a kind of an overview, a beginner's look at this. If you're working with me one-on-one, we're going to continue to expand on this based on how your body's progressing and what you need and what I continue to assess and find out about your body and how it's responding to treatment. I can offer some more solutions, okay, and more ways to use the ball. If you're brand new to this and you're just getting started, you know, stick with it. Try it out. You know, shoot for that 5-minute hold and do it consistently every day, okay? 5 minutes every day on the ball in a nice supported position on the bed. Moving to the floor in time, if your body can tolerate that, is a great way to start, okay? But consistency is key in order to unravel these soft tissue restrictions in your body. Especially if you've had pain and dysfunction and tension for years, it's gonna take some time to unravel that. If you want to get there quicker and you're not currently working with me as a you know, a patient one-on-one, reach out to me. I would love to help you. If you're not in my area, reach out anyway. I have a lot of resources with other therapists around the United States for sure, and even international. If you need help finding somebody in your area, I can help you do that, okay? So thank you for watching. Reach out to me if you have any questions, okay? Thank you. Bye-bye.